I'm Dr. Sharath, a cosmetic plastic surgeon in KIMS Kondapur. Today I would like to speak to you about blepharoplasty. Blepharoplasty is a surgery for the eyelids. Usually eyelids have sometimes lag skin. It could involve the upper eyelid or the lower eyelid. Depending on which eyelid is involved, the surgery entails removal of the excess skin, excess fat, or trimming of the muscle, depending on the components that are involved. Usually 3 or sometimes 1 or 2 of those components can be involved. If both the eyelids are involved, usually it is the upper lid which is done first. Individuals who have lax upper or lower eyelid with that excess overhanging skin of the lids blocking their vision when they on their lateral gaze and having a tired look usually undergo this surgery. Usually you should see a cosmetic plastic surgeon or a plastic surgeon who is experienced in doing these procedures, and once the consultation happens, the consultant will assess your excess of the upper or the lower lid, the amount of tear production that you're getting, and your visual field is also mapped out so that your eye visual, the extent of appropriateness of your vision or the blockage due to the extra fold is assessed prior to the surgery. Also, any underlying medical conditions will be ruled out, like thyroid abnormalities, and they are treated appropriately. If there's been a history of smoking, you would be advised to stop that a few weeks before. If you're on any blood thinners, you'll be advised to stop them at least 2 weeks prior with knowledge of your consultant who's put you on those medication. Usually the surgery of the upper lid involves an incision along the lid fold, and the surgery is done under either local anesthesia or if you're anxious under general anesthesia. The extra skin is muscle, and sometimes the fat is taken away, making sure that the surgery is done appropriately and not too much of skin is not taken out. Similarly, in the lower lid, the extra skin, underlying muscle and fat is taken away through an incision which is just below the eyelashes, or sometimes from the inner aspect of the lower lid. And once this extra bit is taken away, it is stitched in place, and we would advise cold compresses for the next 48 hours. There would be some amount of bruising there. It can be either upper lid laxity or the lower lid laxity. Lower lid laxity is called puffy eye or eye bags under the surgery, and there are pockets of these fat present in the lids which need to be taken out to the appropriate extent. If excess is taken out, it results in a hollow look of the eyes. If very little is taken out, the surgical result will not be appropriate. So an experienced surgeon would be the best bet when you are having this surgery. After the surgery, there will be some amount of bruising. A tiny dressing would be there, which is called a steri-strip along the incision mark, and depending on the suture material which is used, which could be an absorbable one or a non-absorbable one, a suture removal needs to be done if it is a non-absorbable suture material after a week. The steri-strips also will be taken down in a week's time. The cold compresses will help in limiting the bruising, and normal gaze will be maintained. After a week, you can return to your usual activities. As I have mentioned earlier, depending on the laxity of upper or lower lid, usually the lower lid eye bags result in a tired look, with the patient not having enough confidence in getting on with his usual activities when being noticed for that. And people, when you meet somebody, also they do notice this tired look. And if it is affecting the visual field, also the surgery will improve the visual field. Other medical conditions, however, need to be ruled out.